Battling cancer is difficult on so many levels. It involves a fight to beat an often killer disease and a fight to maintain positivity while dealing with side effects like sickness and hair loss. Tonight we meet two local women fighting breast cancer and taking steps to preserve their self-esteem.
I felt that my hormones were off. I was having symptoms. I felt like I was pregnant, although I knew I wasn't pregnant.
There's something to be said for a woman's intuition. When she was 38, Kelly Monroe of Clovis had a strong feeling something wasn't right. It took a year of blood tests and questions for the shocking result.
We took our youngest daughter with us, our 4-year-old, and she was in the room when they told me that I had breast cancer, because I went in not thinking that was going to be the case.
In June of 2018, Kelly began the fight against a disease that strikes 1 in 8 women. She was diagnosed with stage 1 invasive ductal carcinoma. She had a double mastectomy and 12 rounds of chemotherapy, finishing in November.
So
no one would ever know that you are a cancer patient.
Correct. Yes.
She used a system called cold capping to preserve her hair at the urging of a friend, her husband, but especially her daughters.
My daughters begged for me to please save my hair. That was a big thing for them.
For each of Kelly's 12 chemo treatments, she used the Arctic cold cap system. Wearing ice-cold, tight-fitting caps stored in dry ice to -25 degrees to freeze her hair follicles and keep the chemo drugs away. Changing the caps every 20 minutes for about 8 hours each time. Arctic is one of about a half-dozen companies in the U.S. offering cold caps for rent to cancer patients. Circo D'Angelo is CEO. He says cold capping is a patient's choice.
They essentially order the caps and and then they conduct the treatment on the days that they have chemotherapy.
D'Angelo says cold caps are 65 to 90% effective depending on the strength of the chemo drugs. Patients treated for solid mass cancers like breast, ovarian, lung, or liver are typically candidates. Arctic charges $379 a month to rent 8 caps and the supplies. Breast cancer patient 39-year-old Anna Martha Dahl Campbell of Easton is in the middle of her chemo treatments after finding a lump in her left breast in January.
See how this one then is going to attach here.
With her mother's help, she demonstrates strapping on a cap. While chemo and cold capping aren't easy, after 2 rounds, she has lost some hair, but she's hoping it's still worth it.
For me, it's more that I just kind of want life to be as normal as possible while it doesn't feel very normal.
Kelly Monroe removed her last cold cap 6 months ago on November 26, 2018, celebrating with her family and a nearly full head of hair, a process she describes as long and tedious, but the right thing for her.
I did it primarily for my daughters. But in the long run, I know that it helped me too.
While Kelly continues to undergo treatment, her intuition is leading the way, pushing her to get answers and receive treatment her way, what's best for her health, her family, and her self-esteem.
Bye, love you.
I do want to mention that both Kelly and Anna found their own cancers. It serves as a good reminder about our Buddy Check program, which reminds women to check for cancer every month by doing a breast self-exam. Buddy Check Day is this Friday, the 24th. You can go to our website for more information on that, and I'll also be putting a link to the website for the Arctic cold caps, which are now covered by some insurance companies, and there even are some grants available for patients. So it's definitely something worth looking into if preserving your hair is important.
It's innovation. Once again, we can't find a cure for cancer. I mean,
not yet.
I mean, we're looking for that, but here's a sense to help with everything else that's going on, right? Because you're thinking about so many things, and here's this one thing that can help you just give you a little bit better spirit.
Yeah,
right?
help you get through it and feel more positive, and that's what both of them said. So it's definitely an option that is worth looking into.